Linda, can we have volume on Freddie's mic?
Start again. Good evening. I'm Freddie Norris, and I've been asked to be a moderator and a facilitator for this forum on community health care. With us tonight is Dr. Melissa Walton-Shirley, local cardiologist, Dr. Barren, local orthopedist, and D.T. Froge, a local concerned citizen. You've been given an opportunity to place your questions, suggestions, or concerns on one of the question cards in the bowl in the front of the meeting hallway. If you have patient care concerns or incidents in which you would request a chart review, Dr. David German, the current chief of the Internal Medicine Department, has volunteered to review those charts so that those concerns can be addressed. In the separate bowl for patient care concerns, you will need to place the name, contact number, approximate month and year of the incident, so you can be contacted at a later date with answers and information on how it was addressed. You may be asked to sign a HIPAA waiver at a later date as the process develops. During the course of the meeting, if you think of other issues you would like to have addressed, please feel free to carry them out back where someone will be waiting to help you. On any card, we request your name, your phone number, and your email address. The panel wants to make the point this will be an orderly and respectful meeting. It will not be a debate. Any questions that cannot be read aloud tonight because of the constraints of time will most definitely be read by the committee. The panel is here to ask you, the community, the following questions. Are you, as a community, interested in the changes that have occurred in the local healthcare environment? Are there topics of common interest? It is our hope this meeting will culminate in the formulation of 4 separate committees made up of concerned citizens who will be willing to help obtain the answers to your questions that we cannot answer tonight. At the conclusion of this program, at about 8 p.m., you will be given an opportunity to sign up on one of 4 teams on pieces of paper in the hallway where you entered. This is your opportunity to help take ownership of our local community hospital and help drive much needed change. We encourage your participation as it will be the greatest catalyst for change in our healthcare environment. There are 4 committees that will consist of the following. Committee number 1, Hospital Board Committee. This committee will meet regarding the infrastructure of the hospital, nonprofit versus for-profit stance, questions of tenure for board members, how does one become a board member, and to whom does the board and administration answer? Committee number 2, civic issues. This committee will explore the impact of our community on local businesses, competition for local business, the impact of the infrastructure of our hospital on our local county and city property tax, and conduct an exploration of the purpose of spending large amounts of money on advertising in our local community. Committee 3, financial sensitivity. Why are there interest rates charged on outstanding bills? Why are there issues with forced bankruptcy rather than a comfortable payment plan, legibility, and itemization of bills? Can there be a timely billing period following services rendered? Committee number 4, management of patient care issues. Why are there so many patients choosing their care at other hospitals? How can a patient with a complaint be guaranteed that a concern will be addressed in a manner that will impact the next patient with a similar situation? Can there be a timely mediation between patients and care providers on topics of concern? Within several weeks, these teams will meet. The information from this meeting will culminate in an open letter to the editors of our local newspapers, asking that our board members and administrators be willing to meet for a day-long summit on our community's health care. We encourage as many citizens as are willing to meeting to come sign up for this very important work in our community. We're going to hear from the panel, starting with Dr. Melissa Walton-Shirley.
I thank each and every one of you for coming tonight. It shows us that you really care about what's going on in healthcare in our community. Our local hospital is my community hospital too. TJ Samson is me too. I was born on the OB ward at TJ Samson, and I later gave birth to our youngest daughter, Erin, there in 1992. In 91, with offers to join other cardiology groups in Louisville, I chose to come back to this community because I love this community. It was my dream to help my friends, my family, and anyone else who might need my help in the cardiovascular arena. Our local hospital was already thriving then. It continued to thrive until just a few years ago. Over the last 2 years, especially, ward after ward has closed at our hospital. Many excellent techs and nurses have lost their jobs or been displaced. And never in the history of my time in this area have I ever heard so many people say, I will never go back there again. Because of these issues, we as physicians have had meeting after meeting. I was told over and over, there really aren't any problems, or there have been no patient complaints. I made several visits to several individual board members, many more than once. We met with the CEO several times and met with the subcommittee of the board. We were either told, I understand, or yes, it needs to be addressed, thank you for coming, but really not much action was taken until Friday. I received a letter of reprimand from our subcommittee at the hospital telling me that I had utilized inappropriate channels to address these issues, that there are other avenues available to be utilized. I will tell you that several of us have already utilized those appropriate avenues. We've been up and down those avenues multiple times. We have been either ignored or blocked, and in some instances, we've actually been made fun of. A year ago, I'm embarrassed to admit that I just finally stopped. There was such frustration. Some of my friends and colleagues joined the hospital out of fear of having to deal with the changing healthcare climate. It made good financial sense for them, and we don't hold it against them, and we still love them. Some of the most vulnerable physicians joined because of acute, urgent financial needs. Others left, and more will disappear from our ranks. Some are forced into early retirement, not because they're not good for their patients, not because they don't have a lot still to offer their patients, but because they are disheartened. They're tired of fighting an uphill battle that should have never been waged on any front. Instead, like other communities where healthcare change has come, they should have been nurtured, encouraged, utilized, not ostracized. A wise administration would never pit comrade against comrade. I tell you with perfect clarity tonight that I want my community hospital to grow again. I want our wards to be full of people who need our help. instead of filling neighboring hospitals who are currently full of our community members. I want us to not just fill the beds that we've staffed. I want to staff all the beds and fill them with those in need. We want our largest local employer to create more jobs and make their employees feel more secure in their jobs, not afraid to come to a large meeting such as this to voice their concerns. Because we as a physician community have failed, we've taken the issues to you, the public. I chose an unconventional, uncomfortable medium in Facebook because nothing else had worked. When I hit the send button, I hoped and prayed at that very moment that it might be the one thing, the one last hope that could bring us all together for good. A year ago, somebody told me, "Well, Shirley, if you do something stupid, make sure you tell the truth." And that's exactly what I did. I'm at peace with it tonight, and we are overjoyed with your presence here. This is a great community gathering. You, the community, are all that can make a difference at this point. I implore each and every one of you to step up, become involved, reach out, and through your efforts, you can help the next one of us who might awaken in the middle of the night, ill or might become injured. When that happens to any one of us, our first thought in this community should be, I have to get to my hospital. Instead, many of you who are here tonight have told us, I don't want to go to our local hospital. And it pains me greatly to hear that. It has been said that how a society treats its frail, its helpless, or its sick tells you something about that society. We as a community are better than what we have become. We have found each other tonight. Now we can start to figure out what's wrong. What exactly are our concerns? And I'm hopeful that you will come together and come to the realization that we as the community are the only ones who can change it now. I'm convinced that if we work together with a common goal, starting tonight, we will put community back into our community hospital. Thank you.
Dr. Barry Listener. D.T. Roach, excuse me.
Hello, my name is D.T. Froze, resident of Glasgow. Been that way all my life. I can't see with my glasses on, so I'll have to take them off. First off, I do not wish to have any remarks that I may construe to criticize the staff of the hospital providing those services. My personal experience with the staff and doctors associated with the community hospital has been excellent. I count many of them as my friends, and I won't believe they have anything but the best intention for their patients. My grandfather was one of the first and earliest promoter and organizer of the community hospital. I was born there. Many of my friends were born there and died there too. And at some point, I probably will too. That group that initially started the hospital envisioned a community hospital for the physicians to place their patients to be cared for and given proper care.